This is a step-by-step guide to corneal gluing. Corneal glue can be performed at the slit lamps with the patient upright or in theatres with the patient supine. This video will demonstrate the slit lamp technique. The glue used here is a cyanoacrylate glue called Liquiband Standard. It is useful to have a corneal glue pack. Our corneal glue pack contains the following: a dressing pack, sterile clear drape, insulin syringe, punch biopsies of varying sizes, a green needle, disposable plain or curved forceps, sterile gloves, sterile cotton buds and eye spears, carbomer gel, corneal glue, and a bandage contact lens. This is a photograph of everything laid out within the sterile field. The bandage contact lens and gloves are not pictured here. The first step is to use the punch biopsy to create discs from the sterile drape. The size of your punch biopsy will depend on the size of the defect. You generally would want to oversize by at least 1 millimeter. Place the discs to one side to be used a little bit later. We are arranging them in a single line so they do not overlap. Place the end of your cotton bud stick into the carbomer gel and gently touch the sterile disc. This will allow you to pick it up in a nice, easy manner. And it stays on very nicely, as you can see. The next step is to open the glue and draw the glue up into an insulin syringe. The reason why we do this is to allow using the smallest amount of glue possible during the procedure, which is often not possible if you are using the glue directly from the container. Next, place 1 drop of glue onto the disc. As the glue is transparent, it is helpful to do this with the slit lamp, as it allows you to see how much glue you are actually using. You can then set this aside and the glue will not solidify until it touches the eye. Instill topical anesthetic into the patient's eye. Next, debride the epithelium surrounding the perforation with the green needle or with a spear. This is because the glue will only stick to bare stroma. Using a spear, dry the area overlying the perforation. Ensure that you have your glue patch ready in your dominant hand so you can immediately place the glue onto the perforation site. Gently press on the cornea and hold this there for 5 seconds. This should be enough time for the glue to adhere. If the glue patch is not sitting flat against the cornea, it may be worth removing it and starting again. The last thing to do is to place a bandage contact lens on the patient's eye. The patient will then need to be reassessed in 30 minutes to an hour to ensure the anterior chamber has reformed. We hope you found this video helpful. Thank you.